Hello, I'm Dr. Amit Sharma. I'm an interventional cardiologist based in Mumbai, and I deal with treating heart disease and also prevention of heart disease. Cardiovascular disease does have risk factors. Some of them are modifiable risk factors by means of which you can modify these risk factors so that your risk of heart disease gets annulled. Whereas there are other risk factors which are non-modifiable. For example, your genetics. If you have a very strong family history of heart disease, then there is a fair chance that you may also have a similar kind of illness. Now, when we talk of the modifiable risk factors in particular, we do know that cholesterol stands out among these. And then in particular, we know that you have a good cholesterol and you have a bad cholesterol. Among the bad cholesterol, we know the total cholesterol, the LDL cholesterol, when their levels increase, they are known to create an environment which is more inflammatory in nature inside the coronary arteries. And that can precipitate what we typically see as the blockages in the heart arteries. While we talk about the bad cholesterol, nature has also endowed us with good cholesterol, which is HDL cholesterol. This HDL cholesterol, if it is on the higher side, it is better for us, and this takes care of the bad cholesterol and its effects in sort like neutralizing the bad cholesterol. So hence having a balance of this is very necessary, and we know that a majority of this cholesterol comes from the diet. So modifying our diet, modifying our lifestyle is the most important thing that I believe is going to prevent heart disease. Obesity by itself, it has a direct or an indirect action in causing heart problems. Obesity in its indirect form, let's say a person who is obese, this particular person may be prone to develop illnesses related to obesity. For example, he may turn out to be hypertensive, he may turn out to be a diabetic because he's obese, he has no exercise, so he's likely to have a sedentary lifestyle. So these individuals are likely to get diabetes and hypertension. And when these individuals get hypertension and diabetes, invariably they are at high risk for developing coronary artery disease. But in short, interest has now centered in obesity by itself, causing a form of heart failure, what we call as heart failure with preserved ejection fraction. And hence I feel obesity is one of the areas which we need to focus on if we need to bring down the incidence of heart disease. Now, among hypertension and diabetes, unfortunately, these both are silent illnesses. You do not get any predisposing evidence that you are going to get hypertension or diabetes. Most often than not, most of our patients are usually detected, in the clinic when they come to us for some other complaint, and a random blood pressure check reveals that the person is hypertensive. Similar thing with diabetes, that we need to diagnose these patients early, because if you're going to treat them early, you're going to prevent heart disease early. Pertaining to your heart problems, diagnosis of heart disease, well, heart disease per se will manifest in terms of a typical symptom, what we call as angina. Anginal symptoms are nothing but a chest pain, which refers to the pain in the center of the chest and often radiating to the left arm or radiating to the left shoulder, associated with severe sweating. This is your typical symptom of angina that a person may have. But remember, in diabetics, and particularly in females, you may miss them because they may not have these typical symptoms. They may come to you directly with breathing difficulties. So most often than not, this may be missed, thinking that this is more likely to be a lung issue than a heart issue. Another thing that we have seen most commonly is in people who present to us with acidity. That is their most common complaint. Now, these patients who have any sort of acidity or dyspepsia, what we call in medical parlance, naturally needs evaluation, and a baseline ECG at any given point in time is definitely indicated in any patient whose acidity is not subsiding if more than 2 hours have elapsed since the onset of symptoms. A heart-strong India, when I look at the term, I look at it from this perspective that to make India heart-strong, we will need to address few issues. And most of these issues are, I believe, diet and lifestyle issues. Because as I mentioned to you earlier, that with rapid urbanization, we tend to be aping the West more. And when we mimic their pattern, We also mimic their food patterns, we mimic their lifestyle patterns, etc. So I think the time has come for us to go back to the drawing table, look at what we eat, whether we are exercising enough, whether we are getting that kind of 150 minutes per week of cardiovascular exercise in a week. Unfortunately, that doesn't seem to be happening. So these are some of the things. So I believe when you say a heart-strong India, I believe in prevention. Prevention is going to be the most important modality here. We have to pick up these people early, counsel them with the aim for them to modify their lifestyle. Once we do that, once we counsel them and make them more aware of the risk of these particular risk factors, then definitely this will go a long way in controlling the heart disease, I believe.